Hello, good afternoon, Denise. Lovely to see you. I'm one of the people that nominated you for the role of president, and I did that because you're a person of integrity, and I believe that you're the right person for the role at this time. I have three questions that members may like to hear your response to. Tell us about yourself and what you feel you would bring to the role.
So thank you, Cynthia, and thank you for that kind introduction. And also thank you for nominating me, and thank you to Claire as well for nominating me. So my name is Denise. I've been working in the health service for many, many years. I started my career as a cleaner in the accident emergency department. I've worked as a healthcare assistant. I've then registered as a nurse. I've worked in surgical settings, gynae, community education. Worked for the Royal College of Nursing for a few years as the National Advisor for Students. I've worked as Director of Nursing in a number of settings, and more recently now I'm working as a Director for Patient Safety. I'm absolutely passionately focused on improving safety for patients and also for support for staff. So that's where I am today.
Thank you. So very vast, different roles. Different experiences. So what would then be your priorities even, if you're elected to this role?
So I've taken an opportunity over the last few weeks to speak to a number of nurses in a number of different settings. So that's nurses that work in palliative care, work in the charity sector, work in care homes, work in mental health services and critical care, and a whole range of other settings. And what's really interesting is there's a lot of common themes in what they're looking for in their future president. They're wanting someone that is going to be inclusive, going to reach out no matter what part of nursing they work and let their voice be heard. That's someone that's going to really be passionate about the value of nursing and promoting high value nursing standards as well as midwifery standards, support our healthcare workers and healthcare support workers in career progression, around equity, valuing diversity, giving opportunities for all. And they are absolutely all of one voice, that they believe that the Royal College of Nursing should be more outward looking and should be looking to engage with them so that all voices are represented.
Thank you for that. Okay, so my last question then is, why should members vote for you?
I think that for me, the reason that members should vote for me is because I absolutely passionately care about promoting the value of nursing. I think it is really important that the Royal College of Nursing is inclusive, values the diversity of our membership, and is absolutely committed to representing nurses no matter where they work, both in the NHS and outside of the NHS. I'm very committed to being clear that we are all kind to each other, that we respect each other, that we recognise our differences, that sometimes we have to respectfully challenge, but that is done with kindness and respect. And I also want to be committed to making sure that we listen to the voices of the public that we serve, so that the families and the public that are receiving nursing care, whether it's in the hospital and they're waiting for a call bell to be answered, or whether it's in the community and they're waiting for a nurse to call, or they're trying to access mental health services, that we listen to the voices of what the public want us to be as nurses, and we use and align that support to be the best nursing profession that we can be.
Thank you so much for your time this afternoon.